everyone. Trudy is the Director of Medical Education for Organ Health at Natera. Trudy is an ABGC certified genetic counselor with over 15 years of clinical experience in prenatal, pediatric, and adult genetics, and 7 years of laboratory and medical education experience. She's a graduate of the University of Michigan Genetic Counseling Program, and she is also the past president of the Michigan Association of Genetic Counselors and a former instructor at the Michigan State University College of Human Medicine. Welcome, Trudy.
Thanks, Laurie. Thanks, everyone.
I'm gonna bring Monica on too and introduce her while I'm in that mode, and then you guys can take it from there. Monica Johnson is a medical science liaison manager for organ health at Natera. She has over 25 years of experience in organ donation and transplantation. She's a registered nurse with a bachelor's of science in nursing from Linfield University and a master of science from Antioch University, Seattle. Welcome.
Well, thank you so much, Laurie, and to RSN for having us. We're so pleased to be here. And as Laurie mentioned, my background is in genetic counseling, but I haven't been in a clinic in a number of years. And I had the opportunity to come and speak to some patients through RSN earlier this year. And it was one of my favorite things that I've done this year, because I really miss being able to talk to patients and people about genetic conditions. And so today we've got two different sections that we're going to discuss on two different types of tests that Natera offers. I'm going to talk about our Renascite genetics testing panel, and Monica is going to talk about our Prosperi transplant rejection assessment test, Prosperi. And so just wanted to kind of say we're happy to answer broad questions, but obviously information provided here does not constitute medical advice. So let's start with the genetic test, Renascite. When I first started at Natera, one of the things that I really liked about this company was they really are very patient focused. We want to figure out what do patients need who have a variety of different conditions, and how can we use the technology that we have at our fingertips to provide better options for patients. And one of the most recent developments that we launched in May of 2020 was a genetic testing panel called Renascite, because as this slide says, your genes have a lot to say about your kidney health. And I think this is a really exciting time to be looking at merging genetic testing and kidney disease to say, what are the possibilities that we can uncover now that can hopefully improve patient care? And what can learning more about the genetics of kidney disease help us even further down the road with research and clinical trials? So what I want to do is just give you a quick background review of genetics. For most people, this is something that, I remember I used to have patients tell me all the time that they thought it was very odd that I liked genetics, because most people, it's not their favorite thing. So as soon as you're out of school, you tend to maybe not gravitate towards genetics. So what I'd like to just kind of review what we're talking about when we're talking about genetic testing and, genetic disease. So I think everybody is aware all of our bodies are made up of billions and billions of cells. And inside every cell is what we call a nucleus. And the nucleus is really the home for all of our genetic information. And all of our genetic information is packaged in something called chromosomes. We have 46 chromosomes in every single cell in our body. So that's just a ton of genetic information. I think of a chromosome as like a recipe book. And so there's basically 46 recipe books that tell a human how to develop into a human, from that first egg and sperm into the baby that's born 9 months later. The chromosomes, those 46 recipe books, are telling your body how to develop. They're giving your body all the instructions, and all of the things that are all of the body functions that continue through your life are all from these recipe books. The individual recipes are made up of DNA, and the individual recipes are actually our genes. And there's probably about 30 or 40,000 different genes in the human body that have all sorts of different functions. The development of your heart, how your heart continues to beat throughout your life, metabolism of your breakfast. These are all things that are coded by different genes. And we know that if there's an error in the gene, just like if there's an error in a recipe, that can cause problems in the final product. So, one of the examples we use is if you're following a recipe for baking a cake and it says use 2 cups of flour, but then there's all of a sudden a table that says use 20 cups of flour. The end product is not going to look like the cake that you were expecting. This is kind of how we look at genetic conditions, genetic disease, is that there's a recipe that has a change in it. Sometimes that change can be called a variant, it can be called a mutation, but that change in the gene causes that gene not to work correctly. So that final product doesn't work the way that we expect it to. And that results in genetic disease. And depending on what that gene's function was supposed to be, we can see all sorts of different genetic diseases. And what we're going to focus on today is talking about what are some genes that can have changes in them that can cause kidney disease. And what are some important things for people with kidney disease or kidney disease family history to know about the genetics of kidney disease. One of the first things that we look at if I saw a family and they were talking about their personal diagnosis of kidney disease is I'd want to know, do they have other family members that have kidney disease? Do they have the same kind of symptoms? How early was their age of onset? This can give us clues to whether or not somebody's kidney disease could be genetic or not. Not always, but it also lets us know if it might be genetic, who might be at risk in the family? How is this inherited? Is this inherited from a parent who has the same condition, like autosomal dominant polycystic kidney disease? Or if a parent has it, every child has a 50% chance of inheriting it. And you tend to see a lot of people in the family with that condition. Is it recessive, where you probably don't see a whole lot of other people in the family affected with that condition? Or is it X-linked or carried on the X chromosome, where we tend to see boys more severely affected than girls? So these are kind of just very broad descriptions of how genetic disease can be inherited in the family. And that's why it's really important for everybody to know their family history and to find out more information about, mom, dad, grandpa, et cetera, for all of your health, not just your kidney health, to look at, are there things that could be running in a family? And if so, how could they maybe be inherited? And why do we care specifically about genetics and chronic kidney disease? Well, we know that about 1 in 10 patients, there's been a lot of studies that have been even very recently published, 1 in 10 patients diagnosed with chronic kidney disease actually have a genetic cause for that kidney disease. That's pretty high. That's pretty consistent with, if you look at the rate of cancer diagnoses, about 10% of cancers are inherited or are genetic, and about 90% are sporadic or just happen without an inherited gene in the family. This number is even higher in children. So the earlier the age of onset of kidney disease, the more severe kidney disease is, the more likely it is to have a genetic diagnosis. It's almost twice as likely to be genetic. So 1 in 5 children diagnosed with CKD have a genetic etiology. So this is sometimes often where we see adults diagnosed with kidney disease because they've had a child who was diagnosed who maybe had more severe symptoms later, depending on the condition. Then we go look in the family history and say, oh, maybe there's some adults that had a milder presentation. And about this number actually kind of surprised me when I first learned about kidney disease. Was about 25% of patients with chronic kidney disease have a family history. And so this is really important to learn more about what are the risks to that individual. Are there things that we can learn about the underlying genetic cause? Are there things that we can help diagnose other family members earlier? Does that help their diagnosis and their treatment? Does that help not to have a correct diagnosis as well? So I'm going to just play a video. Hopefully this works. We'll cross our fingers to give you a background on the Renascite genetic panel. So the quick background on this is we spent a lot of time looking at what do nephrologists and patients tell us they need when they're looking at genetic testing, and how do we build a genetic panel that meets those needs? So what we launched is a 385 gene panel. So we look at 385 different genes that can cause kidney disease. For example, autosomal dominant polycystic kidney disease is probably the most common, Alport syndrome. And there's also genes on there where it may not be a strongly kidney disease, but we can have kidney dysfunction as one of the symptoms. So it's kind of a broad panel to say, if there's kidney disease and you have certain characteristics, or there's a family history, this might be a great test to learn more about what could be causing your kidney disease. So let me see if I can play this. Is it working?
Does it have sound?
Oh, let me see. Let me mute it. I think I have to do something maybe to get the sound.
Technology.
Oh, share sound. Let's see. Let me try this again. Thanks, Lori. Thought it might be too good to be true that it worked the first time. Can you hear it now?
It can help you understand if there's a genetic reason for your kidney disease, or if you may be at increased risk due to your family history. Approximately 1 in 10 cases of chronic kidney disease is genetic, and identifying the responsible gene has a direct impact on treatment. Genetic testing can help in many ways, including identifying the underlying cause for your kidney disease, the risk of progression, provide guidance on effective medication, and the need for referrals to other specialists. Renascite is a comprehensive test that analyzes over 380 genes associated with kidney disease. It uses next-generation sequencing, an advanced technology that delivers greater than 99% detection rates across the genes screened. Renascite results show whether a disease-causing or likely disease-causing variant has been detected for a specific condition. A variant is when a portion of a gene appears different from the expected appearance. Knowing this information provides valuable information for your care. Once your physician determines Renascite is right for you, the testing process consists of 3 simple steps. 1. Your physician orders the test. 2. You provide a blood or saliva sample. Natera can schedule a blood draw specialist to come to you or ship you a saliva kit. 3. Results will be ready in approximately 3 weeks. To ensure you have all your questions answered about the test and its results, Natera provides complimentary information sessions with one of our board-certified genetic counselors. We understand cost can be an important factor in your decision-making, which is why Natera is committed to making the Renascite genetic test accessible for all patients. We welcome all insurance plans and provide affordable testing through a variety of payment methods, including discounted self-pay pricing and financial assistance through our compassionate care program. Discover more about your kidney health, choose Renascite, and learn how it can help inform treatment strategies. The Renascite.
I don't think I need to watch it again. Okay, so why consider genetic testing? And I'm not sharing anymore, am I?
I'm sorry, I did that.
Oh, that's fine. Can you see it again? Are you back?
You're good to go. Sorry about
Okay,
that.
no problem. Okay, so why think about genetic testing? These are kind of the buckets that we think about of what is the clinical utility or what is the value to a provider and a patient to do genetic testing. One, we want to identify what the underlying cause of the kidney disease is, and does that help us determine the progression? Some genetic conditions, or some conditions in general, if we make a correct diagnosis, can give us targeted therapies to really tailor or give personalized medicine. There's a lot of research that is going into clinical trials, and we need sometimes to have the best diagnosis possible, and then we can learn more about those conditions because we have clinical trial enrollment for those specific conditions, especially rare disease. And then we can manage for advanced disease based on personalized information. We hear a lot about personalized medicine. What does that mean? Sometimes it starts with your genetics. And you can also test family members or offer genetic counseling and family risk assessment, because that's kind of the nature of genetic testing. Is if you diagnose a genetic condition in the family, are there other family members who could also benefit from this information? Nope. Okay, so how to know if genetic testing is right for you? If you answer yes to any of the questions below, we recommend you talk to your healthcare provider, as genetic testing may be something you'd want to consider. So if you've been diagnosed with kidney disease, is the cause of your kidney disease known? There's been a lot of studies that say that unknown causes, if you have an unknown cause for kidney disease, about 15 to 20% of the time, there can be a genetic cause for that. So that can be very valuable. Have you had, or do you have protein in your urine? Have you had, or do you have blood in your urine? Do you have cysts in your kidneys? Were you born with a structural defect in your kidney? Or do you have any known family history of kidney disease or family members who have had protein or blood in their urine or cysts on their kidneys? So obviously this is a very broad list. A lot of people will say yes to at least one of these questions. And that's kind of on purpose to say, we think that genetic testing can be beneficial to a lot of people, but it is definitely a conversation that you want to have with your family, with your provider, and think about, is this the right time? Is this the right test for you? So I just want to go over a really quick case of a patient and how it benefited her to have genetic testing and some answers. So I have a patient, this is a real patient who had a Renascite test we changed all of her, we'll call her Angela, in her late 60s. And she had an unknown cause for her kidney disease, but it progressed to the point where she needed a transplant. She had a kidney transplant from her 42-year-old daughter. Her diagnosis was diabetes and hypertension related kidney disease. Her family history was not known. But after her transplant, the provider was concerned because her serum creatinine remained elevated. He wasn't seeing the drop that he was expecting, that he wanted to see post-transplant. So we did a biopsy, and there were some unusual findings, some crystal deposits, some inflammation. And so, it was kind of a little bit of a mystery post-transplant. Why were these things going on? And so to clarify the post-transplant management and see if there was anything else that needed to be considered, they did genetic testing. And the Renascite result was positive for, and this is a mouthful, but a gene called APRT, which stands for autosomal recessive adenine phosphorybyl ribosal transferase deficiency. I'll never have to say that. Hopefully I'll never have to say that again. So this is a rare condition, but the beauty of having this diagnosis is the provider immediately knew, oh, there's a deficiency in a specific enzyme that this patient has that's causing the symptoms I'm still seeing. And all I have to do is give her a very specific medication, this allopurinol, modify her diet, and I can expect to see full recovery and full normalization of her labs and of her projected clinical course. And so both the provider and the patient were expressing to us how happy they were that they did this test, because they could immediately, after having that test, change her management, avoid any further injury to this precious new transplant that she had. And then now they also know that there is a genetic cause for kidney disease and can look at how is this inherited, who else in the family may benefit from genetic testing, and also perhaps more importantly, sometimes who isn't at risk based on how this is inherited, and give them that sense of reassurance that even though a parent may have genetic cause, that the way that it's inherited means that they're not at risk. So how to get started with Renascite? As was mentioned in that video, and I think one of the things that's so valuable that Natera provides is you have access to a board certified genetic counselor even before you have testing. This is absolutely complimentary. Some patients just want to call in and, have a question before they have the test. Is this right for me? Just kind of get a third party opinion about what's going on. And then they also are available after your test comes back. So if you decide, yes, this is the right time for me, I'd like to do genetic testing, your provider would order the test, give you those results back. And if you have additional questions or someone else in the family has questions, they also have access, again, at no charge, to our genetic counseling services, because we know how important it is to have somebody with that background be available to both the provider who's ordering the test, but also to the patient who's receiving those results. As was mentioned, we also are very proactive in making sure that anybody who is getting this test knows exactly what the options are as far as cost. So there is commercial insurance coverage. Natera will estimate your out-of-pocket cost. It's very broad based on what your insurance coverage is. If it exceeds $349, you'll be contacted to discuss payment options. There is also a compassionate care program where if you meet eligibility criteria based on household income, you can pay as little as $0 or up to $149. So there's a couple of different avenues for patient insurance coverage. And if you have government insurance, we do not expect that you would have any out-of-pocket expense. So just a quick recap on how to request a Renascite kit. As Lori mentioned, we have a virtual booth. You can visit that today. We're open all day. Or you can go to natera.com/Renascite and click order a kit. Now, individuals can't order genetic testing on themselves. We need your provider to agree this is the right test for you and order that test, but you can bring that kit to your provider, have them sign the requisition and agree that this is the test that they would like to have performed on you. You provide your sample. We can do this with a blood draw, or we have as mentioned, we have those cheek swab, which is a really nice option. They're both just as accurate. They're both just as easy. So depending on preference, either sample is fantastic. And then about 3 weeks later, your provider would get those results and communicate those results to you. And with that, I think I'm going to turn over to my colleague, Monica, and then we'll take questions on both products, both tests at the end of the presentation. Thank you so much.
Thank you, Trudy. So I'm going to assume that if you're here, you are well informed about how to manage your care after kidney transplantation. So I want to tell you a little bit about another product we have called Prosperi, and it is a transplant assessment to look at rejection. It is optimized surveillance for even more confident results. So I want you just to think about what Trudy mentioned about the DNA being in the cell. This is a different type of assessment because we are looking at DNA that is no longer in the cell.
I think you, Monica, I think you keep hitting mute somehow. So we can't hear this. There we go. There we go.
Blood draw is all it takes. Natera's Prosperi transplant rejection test lets you and your physician identify active kidney transplant rejection earlier and with greater certainty as part of your overall surveillance toolkit. What's more, it's covered by Medicare. You deserve the best chance at a happier, healthier life. As a person living with a transplant, you and your physician understand the importance of preserving kidney function. Knowing more as soon as possible could help you avoid dialysis and prevent you from having to return to the transplant list. Early identification of rejection and informed treatment plans are essential to your lifelong journey as a transplant recipient. That's why there's Prosperi. Prosperi is a cell-free DNA-based blood test that uses the unique genetic signatures of you and your donated organ to create a more precise, personalized test to actively and continuously track your kidney transplant health. In almost real time, Prosperi measures how much cell-free DNA from the transplanted kidney is present in your blood sample. Injury or rejection can cause an increase in the amount of this cell-free DNA and could signal the need for follow-up. Cell-free DNA is a valuable tool to add to current screening and can provide more information than serum creatinine testing alone. With a regular testing schedule in place, Prosperi cell-free DNA-based testing can provide you and your physician with timely information to better manage your kidney health. Natera is here whenever and wherever you need us. We provide ongoing support by guiding you through every step with regular check-ins at every milestone and coordinating blood draws around your schedule. Access Prosperi and your other routine blood labs remotely through Natera's ProReach program. We've made it as simple as possible for you and your physician to incorporate the Prosperi transplant rejection test into your kidney health management. Ask your physician about Prosperi today. The best transplant care depends on the best possible tools for assessment. With Prosperi, the most advanced DNA-based solution for assessing transplant rejection, Natera is working to empower you with more answers about your kidney health.
So let me expand a little bit more on that video. So the cell-free DNA is DNA that is circulating in your bloodstream. It is normal to shed DNA. We all shed DNA because we have to reproduce new DNA. And kidneys shed DNA too, and it looks different than your own. So this slide is showing you basically what the video sort of animated for us, that you get a blood sample. It's just a couple tubes of blood that get sent to our lab. And we look at the sample to say, okay, how much of that DNA in there is from you, the recipient, and how much of that DNA in the sample is from the kidney. And what we're looking for is to say, okay, if there's mostly just your DNA and maybe a few bits from the kidney, it's good. It's a normal sample. It doesn't appear that that could be a sign of any rejection. However, if you get a result, the one on the bottom right, that looks like there might be some more of the kidney DNA mixed in with your own recipient DNA, then it could be something like active rejection. So it's just an assessment or a screening tool to say to your physician, okay, I should probably do something else now that I have this result. Doesn't necessarily mean it's rejection, it's just an indicator. So it is a screening test, much like a mammogram, blood pressure test, things like that. Next slide, please. There we go. So I'm sort of speaking to the choir here because you all know this, that rejection is a type of complication that can happen after surgery, up to even years later. And it does just mean that, you know, your body sees it and is going, wait, this is not good. I don't want this. So the reason that Prosperi is a good test is that this is what can identify that rejection early on, perhaps even before you recognize anything or you see any changes in your lab work or your urine. So knowing as soon as possible about rejection can help you and your care team develop a plan that is best for you and can protect your kidney. Okay, next one. I'm going to skip that last one because we kind of talked about that in the video. So this is what a physician would look at over time. So initially you would get Prosperi drawn and you'd get that first result. And then typically physicians monitor sometimes monthly, sometimes quarterly. It's really up to them what they want to look at, but they see a pattern of how you're doing with your kidney, much like lab work that you see or your immunosuppression drug levels. You see that monitored over time. So this is what your physician would typically see. So what does Natera provide for the patients? And as Trudy mentioned, you know, we really are about patients first. And that's why I also came to work at Natera, was I really felt that that was something that they believed in and it was important. And I'll just share a little bit about what we can offer with Prosperi for you. So we are always by your side through our Prosperi Link program. We will guide you through the whole process of getting your blood drawn and getting the test kit and checking in with you at every milestone. So our team will coordinate the blood draw for you around your schedule. We can have it done at a laboratory, or we can have, as Trudy mentioned also, and it was in the video, a blood draw specialist come to you. They can come to your work or come to your home, either way, whatever works for you. And then our billing outreach program also has flexible payment plans like Trudy was talking about with Renascite, including some financial assistance depending on income. And we don't want to have any patient to have a significant financial hardship in accessing Prosperi. We want every patient to have that opportunity to use it. So along with the blood draw program, we can also draw the rest of your labs. So if your physician says, well, today, you know, I want the, TAC level drawn and they need a UA, and I also want them to have the Prosperi test, the technician can draw all of the labs. They send then the labs that your physician wanted ordered to a specific laboratory. Maybe it's at the transplant center, and then the Prosperi test gets sent off to our laboratory. So you only have to have the blood drawn at one time, and there's no additional charge for that either. So what happens when your provider decides to enroll in the ProReach program? And this too was mentioned briefly in the video, is that the physician will give us the requisition form. They can do that through a paper form, or we also have a portal. And then we send you a kit if you're going to go to a specific lab, and you can take that kit, just like with the Renascite kit, wherever it is you're going to get your blood drawn, or you can go to your doctor's office if that's where you want to get your blood drawn, and they can draw the Prosperi there with that kit. Most patients right now are preferring mobile phlebotomy, the mobile blood draw, and especially since COVID, because it is much more convenient, and then you don't have to expose yourself to any potential risk by going into a clinic or a transplant center. So that person, the lab, whoever it is that drew, either the mobile person or the central lab, we coordinate the shipping so that they know how to ship it to us, and it's just via FedEx. And then in a couple of days, the results come back and your physician will let you know those. So that's sort of how the process works from the beginning to end, where you can get your blood drawn, where you want your blood drawn. Then it gets sent to the lab by the person who drew the blood. And then your physician gets the results in a couple of days and can tell you what those are. So it's fairly quick and fairly simple to do. So I want to just share with you a couple of case studies so you can kind of get an example of what's the impact of Prosperi on real life patients. So I have a couple of them I want to just share with you real quick. So Mary, she is 31 years old. She lives 100 miles away from her transplant center, and her name has also been changed to protect her information. She had end-stage renal disease due to Goodpasture's syndrome, and she's had 2 kidney transplants now. And her PRA was 98% at the time of transplant. And for those of you, I'm sure who know this, that's a significantly high PRA. And she's got DSAs also. Because she lives far from the transplant center, she does have trouble finding transportation to her appointments at times. So recently, she went to her transplant nephrologist back in September of 2020. She had an increased serum creatinine and a Prosperi result of 2.69. Now, our threshold is 1%. So anything above 1% can indicate potential rejection. So hers was 2.69. And then her physician decided to do a biopsy. That was his choice of the next steps on her plan. And the biopsy did confirm that she had antibody-mediated rejection. So what did Prosperi do for this patient? It allowed her doctor to closely track her, specifically with the Prosperi result, and then using that to track over time. And indeed, subsequent results led to that confirmatory biopsy, and it modified her treatment at that point. So for her, that was a positive. She could get mobile draws. She only had to go to the transplant center to get a biopsy, and then the physician could change her treatment plan. And then we have Blake. He is 23 years old. He got a kidney from his mom when he was 16, and he had no complications after surgery, and he actually had no incidences of rejection either. However, a routine lab came back and showed that his creatinine was up to 2, and it had been running around 1.5, and he and his physician were concerned. As you all know, anytime your creatinine goes up, there's something going on that you want to know about. So the Prosperi result was not indicative of rejection, and that was very reassuring to Blake and obviously his physician. And so the assumption is that perhaps he was just dehydrated. It's been over 100 degrees where he lives, and he works outside. So the physician recommended hydrating, and I believe Dr. Villicana mentioned the importance of that as well, so that when he goes back in, he can have another creatinine drawn and perhaps another Prosperi and be reassured that he's not in rejection. So that is what I had for you about Prosperi. And this is, again, the information on how to get your Renascite test. And then we'll take Q&A, some questions if you have any. That would be great. And I will have Trudy come back on screen and we will answer questions.
Thank you very much, guys. I think one of the questions that was answered, but I think I'm really interested in this too about privacy, because everything's about genetic testing and privacy. And can you just elaborate on that a little bit? On the privacy aspect? I think Trudy might be muted.
Yeah, sorry, I think I had. Ooh.
I think you both are muted.
Here we are. Can you hear me now?
Yes, we can.
Okay, Laura, could you repeat that question? I had my actual audio muted.
I know you guys got to go take a flight or something. So if you could give a quick little, summary of privacy.
Sure. Yeah, that was a great question from Patricia in the chat. So we know that we've been a DNA company for as long as Natera has been around, since 2009 and earlier. So we understand the issues with genetics and genetic privacy. And so there is absolutely zero sharing of any kind of genetic data, none for identified data. Sometimes we can use de-identified data in research sets down the road to improve patient care, to improve test performance and to research something. But we only do that on samples. And if you don't tell us, there is an option on a requisition to say, please destroy my sample. I don't want my samples to be used for research after. And so every patient has that option to check out of that if they're concerned about their sample, and then their sample is destroyed immediately after.
And I think you mentioned this, but Medicare helps pay for this test, correct?
Correct.
And I just want to say, and I walk up both sides of the mountain, I've been doing this kidney thing for 53 years. And the evolution, I am so excited about this testing. This is a game changer because I've had so many friends that creatinine starts moving, and I love the analogy. Once your creatinine starts moving, guys, your kidney has been targeted by your little antibodies and it's playing a video game, and eventually it's going to take it out. It's called chronic kidney rejection. And it's so important that we get before that even happens. And it's exciting that this testing is available to be able to see, hey, do I have any DNA blood? It doesn't even know the kidney's there. It doesn't know it. And there's treatments, and I am proof of this because I have a little antibody running around in my bloodstream that has been there for 10 years. And the fact that there's this testing, they have been able to treat me so my creatinine today, and just drum roll, please, okay? 0.6. And this is my 4th kidney transplant. And I had 100% antibodies. So guys, you have to be proactive. And what's sad to say is, and people may not know this, but transplant nephrologists are different than kidney nephrologists. Kidney doctors are in the community and they see people with kidney problems. They may not even know about this testing. You have to tell them and be your advocate and say, I want to be checked, because often the transplant center, gives us back to the nephrologist because they're so busy and say, only call us if there's a problem. Well, you want to prevent a problem. You don't want to call the transplant community. So I just want to reemphasize, we have to be our own advocate. And I have heard on more occasions, and it's just the nature of people take a long time to turn around, is, I've went to different doctors like, oh, we don't do that. Well, why not? We don't do, well, I don't care if you don't do that. I'm different. I'm advocating for myself, and why push? We talked about this yesterday. The pain in the butt survive. And you have to constantly, this is innovative. And I'm just really want to reemphasize to everybody listening that, if you're not getting the answers you want, you can go get a second opinion. And I said that earlier after Dr. V spoke, that there were 2 treatment options for me for my 4th transplant from 2 different facilities, because it's a medical practice. And it's so important. I had to make the choice to change. It was I felt like I went through a divorce. I can't even tell you. I grew up with these people. But at the time, it was what was right for me. And I'm living proof 10 years out with my 4th kidney, 0.6 creatinine. So it can be tough. It's hard to hurt people's feelings or, feel like you're being confrontational, but it's our life and our body. So I'll stop there. That's my little motivational speech. But with that, well, thank you so much, everybody. We can go to the booths right now. We're going to take a little break. And Natera has a section where you can go in and talk to them. And you can go to their booth, learn about it, get informed, share this information with your friends, and help them. We could be saving a life by just knowledge. So we're going to come back at 12:25. Everybody can, I have to say, I have to go to the bathroom. I'm bragging. And we'll come back at 12:25, and we'll do a little bit of exercising, and we'll jump into a raffle, and then onto our next presentation. But again, on behalf of RSN, thank you, Trudy and Monica, for being advocates for people with kidney transplants. And
thank you so much, Lori. It was a pleasure.
And a shout out to our corporate mission partners for making this happen.